When high blood pressure is left untreated, it can damage the blood vessels in the body. Cholesterol and calcium buildup in the artery. Over time, the arteries narrow, restricting blood flow, damaging critical organs like the brain, heart, eyes, and kidneys. Although 26% of Egyptians are diagnosed as hypertensive patients, only 8% of them are reaching their blood pressure treatment goals. WHO shouted that every 2 seconds, one person dies from a cardiovascular disease. And because every life matters, there was a need not only for a remedy, but for a symphony of control. Xtension contains the active ingredient irbesartan, which controls blood pressure by selectively inhibiting angiotensin II receptors, subtype 1. It's indicated for treatment of mild to moderate hypertension, which represent the majority of hypertensive patients in Egypt. When we mention the blood pressure control effect of Xtension, we found a significant superiority over valsartan and losartan in blood pressure reduction effect. Xtension 300 mg was proved to be superior to losartan 100 mg, as it causes a greater reduction in the trough-seated diastolic blood pressure and trough-seated systolic blood pressure, and the results was significant. Xtension plus 150 mg was proved to be superior to valsartan 80 mg. Hydrochlorothiazide combination produced greater reduction in average systolic and diastolic blood pressure. When it comes to end organ protection, Xtension shows a significant optimum critical organ protection. The first sign of high blood pressure affecting the heart is the thickening of a heart muscle. If left untreated, the condition worsens. Over time, high blood pressure causes further narrowing of the arteries, eventually cutting off blood to the heart. When the arteries are critically narrowed, or when a piece of blockage breaks off, a heart attack may occur. High blood pressure is also a leading cause of kidney failure. In the IRMA-2 study, Xtension 300 mg lead to an almost 70% reduction of the risk of diabetic nephropathy. In the IDNT study, Xtension 300 mg significantly reduced the risk of regression of diabetic nephropathy by 23% versus amlodipine 10 mg. In the Swedish study, Xtension 150 mg significantly reduced the left ventricular mass index than atenolol 50 mg at 12, 24, and 48 weeks. Also, Xtension 150 mg caused a higher percentage of patients with normalized left ventricular mass index than atenolol 50 mg. In another study, Xtension 150 mg proved superior to amlodipine 5 mg by significantly reducing the left ventricular mass index at 3 and 6 months. When it comes to safety and tolerability, Xtension proved to be an antihypertensive with a significant high safety and tolerability profile. The incidence of cough was 5 times less with Xtension than with enalapril, which reflects the superior tolerability of Xtension over ACE inhibitors. When we bring the persistence to the spotlight as one of the most important aspects of hypertensive patients' treatment plan success, Xtension shows a distinguished proved superiority. When as monotherapy or in combination, Xtension score a significant higher persistence rate than all other antihypertensives, including the ARBs. The recommended dose in hypertension treatment is 150 mg or 300 mg plus hydrochlorothiazide 12.5 mg once daily. While in nephropathy in type 2 diabetic patients, the recommended maintenance dose is 300 mg once daily. A patient can start with 150 mg, then the dose is titrated up to 300 mg. There is no dose adjustment necessary in elderly patients, hepatic impairment, or mild to severe renal impairment. Extension is available in 4 concentrations scored tablets. Extension 150 milligrams. If further blood pressure reduction is needed, extension plus 150 milligrams or extension 300 milligrams is recommended. If more blood pressure reduction is needed, extension plus 300 milligrams will be the choice. Extension. A symphony of control.